And welcome back to On the Record. So I think that a lot of the information, if people take the time to read it and to look at it, but is there any plans if somebody can't go to the hospital or don't want to go because or they're assessed on the phone and they feel that a home visit would be better to keep them isolated, or would it be better for them to go to the clinic or hospital?
That was a point that had been raised a few years ago. Unfortunately, we don't have the human resources. So people have to be mindful that and we'll have to see how things pan out with the vaccination. So, for example, we knew that if we expected 30% of the population to be ill at any particular time, then it doesn't just affect community members, it affects the healthcare workers as well. So, unfortunately, we don't have the human resources, and the exception to that are our home care patients. So we have, under 200 home care patients that are being followed by home care nursing, and those clients, more than likely, if they are ill, will be assessed in the home by the nurse and or by a physician. But most of the time, people will be required to have to come to our clinic or to an outside clinic.
I think what I guess people or community members, whoever's watching, and I discussed this with other people, is that in the issue in regards to the school and having your children go to school and some of the possibilities or a higher risk to get it there, and a lot of the parents are keeping their kids home. You're never going to change behavior, but even the schools themselves, I think that we have to look at as a whole how that it's going to affect, or what's the blanket effect to that, because if there was 70% of the kids that are staying home, that's 70% of the parents that are not at their jobs. Correct. Even in some of the essential jobs in our community, right, that are the backbone of trying to deal with this whole situation, the doctors, the nurses, right, the firemen, the police, and everybody else. And I think that that's one of the important things, that being more informed, right, before you make decision.
Right. So what we do know that once the virus is in the schools, it's too late because we know that it's a very contagious disease, and we know that children are very good, effective vehicles to transmit this virus. So once you've had a few kids that have this illness, then you know that it's already been introduced into the school. And school closures, all that it does, as you just mentioned, is that then you're sending well children home, and then someone has to take care of them at home. So then you're taking your parents out of the workforce. Some of them may be healthcare workers, and they're not available to continue to do their normal activities. And that has a major impact. So that later on, when they do come down with the flu, if they haven't had their vaccine, then you're going to have a double time of having to stay home. The epidemiology, the studies have not shown it to be a very effective method to control or to contain pandemics. Sometimes, though, if you have, if a third of your teachers are out and a third of your student population are out, and you just can't continue services, sometimes they have, as a reactive mode, closed schools. Mm-hmm. But in terms of proactive, it hasn't been found to be very effective. Mm-hmm.
And I guess that's the basic thing, is to be proactive in dealing with this whole situation. One of the questions that somebody had, and we talked about some of the symptoms earlier, is that if a child has a cough, like a crouping cough, but no fever, there's nothing wrong with them other than that cough, it's like a dry cough. Is that something that they should be?
No. So the flu, by definition, you have to have fever. If you don't have a fever, then it's just a common cold. Or it could be something else. But generally, you have to have fever and you have to have a cough. What we've seen with this particular flu is a very bad sore throat. People have had a little bit of nausea, a little bit of vomiting with it, aches and pains, and fatigue. So people have that. We oftentimes say, well, do you feel you've been hit by a Mack truck? If you say yes and you can't get out of bed, then you have the flu. Children sometimes don't quite express themselves the same way, but normally they stop being as active. They're not, getting into all the trouble that they normally get into. So there's ways of seeing it in children as well, when that they're not themselves. But the fever is really one of the criteria for a diagnosis of flu.
And what's the, I guess there's a train of thought, and some people say, if you have the flu or flu-like symptoms and you have the fever, and stay home for 7 days, or some are saying, 24 hours. Do you isolate them?
Right.
How does that work?
So the recommendation is that if you have flu-like symptoms, and so oftentimes you'll see that being referred to elsewhere, flu-like symptoms. So if you meet the criteria of the flu, we know that you can be shedding virus for 7 days, and we do recommend that people isolate themselves. So you stay home, you don't go to public places, it's not time to go do your groceries, you don't go to the theaters, you don't send your kids to the mall. They have to stay home because they're going to continue. And the risk is not to the majority of the community members, but the risk is to pregnant women. The risk is going to be to people with chronic illness who may get severely ill from this. And so we have no way of predicting necessarily who is more at risk, because we do know that about a third of the people who have been very ill and have died had no risk factors. Mm-hmm. And that's what's different about this virus compared to the seasonal virus, is that it seems to be affecting young people. The people that have ended up in hospital on an average age are 22 or 23 years old. The very high incidence of admissions in the States are in children who are under the age of 4. And the average age of death is 52, I believe. So it's a much younger crowd than what you see with the seasonal flu. And that's the worrisome part of it. So even though it's a small little number, it's a small slice, it's still a significant number to make people be concerned to have a mass vaccination campaign.
In the literature, is the H1N1 the primary or secondary cause for death?
What happens is that people usually die of a complication. And so one of the common complications of H1N1 is a pneumonia. And if you have a bacterial pneumonia, meaning that now you've got a secondary bacteria that has taken an opportunity because you were ill, that's easily treated with antibiotics. But the people that tend to get very, very ill are people who develop a viral pneumonia, and that is much more severe and requiring a lot more treatment, and sometimes having to go on to a respirator. But those, again, are very, very rare. Thankfully, they're quite rare, but the reality is it has more to do with proportions. So because we're all susceptible to this virus, that means that even though it's a small percentage, but because of the volume of people that will potentially be ill, even if the numbers are small, the numbers will be big enough to then strain our healthcare system. Mm-hmm. And so the concern is we're already seeing the emergency rooms being filled up. It's the potential for shortages of beds, and then the shortages in our intensive care units. We have a certain number of intensive care beds in the province, and once you've reached that saturation, there's no more beds. And then so there's going to be ethical decisions having to be taken in terms of
releasing patients,
or making decisions who gets a respirator or not. Now, we believe that in Quebec we have the capacity to increase our intensive care unit beds to 200%, meaning doubling what is currently available. That being said, though, we don't want to get there. We don't want to be faced with this kind of crisis, and that's why the immunization campaign is so critical, because we know without a doubt, there is good evidence to show that vaccination campaigns will make an effort, will have a dent on any wave, and I think we know that the more people that are vaccinated, the better wall you'll be able to put around people who are at risk. If we have a very poor vaccination outcome, what's going to happen is that then this virus will continue to circulate, will continue to be infecting people, and then we may be faced with a third wave, as you were alluding to earlier. And then we may be with a fourth wave, and we don't know if this will then become the seasonal flu. It's too early to tell. What we do know is that the seasonal flu virus is not around. It's been crowded out. It has been not, it's like 97% of the flu cultures are H1N1.
And we'll go a little bit more into that, but we're going to take a quick break.
Okay.
And we'll be back right after these messages.